am just going to focus on the Oxford Brain Story today, rather than our other projects, which broadly fall under the umbrella of how do we improve outcomes for children in the face of adversity, and obviously different types of adversity, thank you, and different types of work. And I'm here presenting on behalf of myself and my usual partner in crime, Elizabeth Raper. So the aim of the Oxford Brain Story is to try and embed an understanding of the importance of why the early years matter in terms of our lifelong health in a UK context. Essentially, it's a public health message in the same way that I could stop people on the street and say, is smoking good for your lungs? Most people would be able to say, well, no, smoking's not a good idea. It's not good for your lungs. It's not good for your heart. Actually, you might end up with lots of different health complications. And even very young children in primary school would be able to give me a rough idea of why they didn't think smoking was necessarily a good idea. And I guess our vision is that we would be able to establish something similar in terms of why our experiences matter, and also importantly what we can do to promote good early experiences and the impact of that for our lifelong health and well-being. And so again, we really want to establish this not just in an education context or in a healthcare context or in social care, but really have this so it becomes a shared understanding across all the different sectors that we might work in, but fundamentally in our communities as well. And very much, although there is a lot of emphasis on the early years, it's really wanting to make sure people understand that this is a lifelong story and that this is something that is universal to all of us, that we all have our own brain story. So today, what I'm going to focus on is giving you a little bit of insight into our experience of trying to embed the brain story in the UK, and also a small taster of how we've tried to evaluate that. So what is the Oxford Brain Story? What's it got? The first thing that I need to say, and I've worked out from having given talks over the last nearly 5 years about the Brain Story, is that I have to say it's free, and I have to say that about 3 times because people never believe it's actually free. My dad always used to say to me, Louise, there's no such thing as a free lunch, but I do genuinely believe this could be the free lunch. Essentially, it's a knowledge-based platform. It draws very heavily on the work of Harvard Centre on the Developing Child. And it is really aiming to be a mechanism to put peer-reviewed, very well-established science into the hands of frontline workers and into the hands of people in our communities. So it is really taking the science that underpins why our early experiences matter so much and how that impacts on later health outcomes, and putting it into a platform that everyone can access. There are also kind of 3, I suppose, particular aspects that I wanted to highlight, and I'll talk through each of those in turn. So the Brain Story has developed a series of explanatory metaphors that explain the key scientific concepts in a way that makes them readily accessible to the general community. And there's a short animation that goes with each. And again, if I ruled the world, it would be the kind of thing that you would see in the advert breaks or before the news, before the soap operas, so that everyone would, in the end, get quite bored of hearing these messages. It also has a self-guided certification course, which is essentially a series of pre-recorded lectures by the great and the good about their science and why their science matters. It's self-paced. Anyone, again, can access it. It handily remembers where you were last time, so you can kind of go back, and I did most of my certification course sitting in the car between my children's general activities. And also, appropriately, because we're at Pedal, it also has a game, which in itself is also a metaphor as well. So, just to give you a flavour of, I guess, the most public-facing part, which is the metaphors, I'll just talk you through briefly each of these in turn. The science, I'm sure, will be very familiar to all of you, but I think it's the way that the Brain Story packages it that makes it very appealing to think about how we can use this in our work. So starting in the top left-hand corner, we start off with brain architecture. The idea that we're not just born with a brain, but actually we have to build our brains. And how do we build our brains? Those of you, I'm sure, within the audience will be very familiar with the idea of contingent responsiveness, which the brain story packages as serve and return. So actually those warm, consistent, reciprocal relationships that can be likened to, I guess, a tennis match or a tennis game between two people or a caregiver and a child. Actually, somebody serves and the other person returns the ball across the net. You're not trying to win the point, you're trying to keep the rally going. And anyone who's played tennis with a child knows that sometimes they want to play very hard and fast across the net, and at other times it's a much slower, loopier game. And again, it's about that idea of pacing. It's a very rich metaphor that people go, oh, right, yeah, now I see what it is. How can we look out for a child's serves? How do children of different ages serve? And equally, how can I return that serve? Another set of skills, which is obviously very important in terms of our lifelong kind of well-being, but also kind of earnings potential and things like that, is our executive functioning skills, which the brain story packages as air traffic control skills, so down in the bottom left. So the concept is that we are all our own air traffic controller, and we have lots of planes in our mental airspace taking off and landing. And we have to prioritise which planes are about to run out of fuel and need to land quickly, which ones can be kept in a holding pattern and going round and round for a little while. Sometimes we can have a lot of planes in our mental airspace, and other times we can have fewer planes. So again, it's a nice, easy way into helping people think about what are these skills? Actually, do I struggle with any of these skills? Am I a good air traffic controller? Actually, do I struggle with my air traffic control sometimes? And is that to do with my own skills, or is that to do with the number of planes I've got at the moment? And we know that our air traffic control system and the development of those skills, again, we're not just born with these skills, we have to learn them, is very sensitive to the environment that we're growing up in, and it's very hard to become a good air traffic controller when you're growing up in an environment that's chaotic and threatening. So if we go up to the top right now, the brain story talks about different types of stress. That actually not all stress is bad, that there can be some positive stress, which is about an opportunity to learn, to grow, to develop new skills. And we call that positive stress. Understandably, sometimes life is not always straightforward. There may be difficult events, a bereavement, a house move, a loss of a job, for example. These aren't necessarily, we wouldn't choose for these things to happen, but they're not necessarily bad for development if we have strong, stable, supportive relationships around us to help buffer that stress response. And I don't know if you can see, there's a little figure essentially throwing a rope down and helping the child up and over the tolerable stress event. And then we can also think about toxic stress. So here we're thinking about, I guess, the traditional ACEs, adverse childhood experiences of abuse and neglect, addiction, but also I think about that more broadly about also including, for example, experiences of systemic racism and so on, which we can think about in terms of toxic stress. So those ideas come together in the resilience scale, which is down on the bottom right-hand side. It's a very simple seesaw. And we can think about those toxic stress or adversities as red boxes over on the left-hand side of the balance scale. And on the other side of the balance scale, we can think about positive supports with, again, a big emphasis on relationships and connection that we've already heard so much about this morning. But also things like access to healthcare, access to education, access to green space. In the pandemic, access to a trampoline and a garden for my kids. And then we can also think about the fulcrum, so the tipping point, which is the purple kind of triangle in the middle. For those of you who can remember science from school or who have been playing around on seesaws recently, you'll know that if we change the position of the fulcrum, we change where the balance scale is going to tip. And the brain story talks about the position of the fulcrum initially being determined by a genetic starting point, but they can also encapsulate the impact of our experiences in terms of epigenetic changes and also our skills and abilities in terms of the position of that fulcrum. So it can actually, although it appears very simple, can become a very rich metaphor to start to think about the different influences on a child or a family or indeed a community's resilience. And also gives a very tangible, practical way to engage the people that we're working with and thinking about what their resilience scale looks like. And again, it's universal. We've all got our resilience scale, and resilience is a dynamic process that changes day to day, week to week, month to month, depending on the balance of our red boxes, our green boxes, and the position of our fulcrum. So we've really wanted, in line with that public health message, take a system-wide approach to sharing this knowledge and this understanding with our wider community and workforce. And we thought about it really in terms of a pyramid model, that level 1, public health message, I'd like everyone to understand a bit about this, and particularly when we're thinking about organisations, more professional settings, absolutely that when we go into a school and do brain story training, it's important that the reception staff are there, it's important that the cleaning staff are there. We want everyone to have a fundamental understanding. With frontline workers who are working with particularly vulnerable groups, having a bit more of an understanding, and again, managers, strategic leaders, and policymakers having a more in-depth understanding. So what does that look like? I guess at level 1, I would love everyone to understand those core brain story metaphors, and we think that takes about an hour, 90 minutes, depending on who we're working with. And then at the next level up, it would be both the brain story metaphors and that core story of why this matters, with additional training around either the early years or adolescence, depending on the age group that people are working with, and also an additional session thinking about the resilience scale and how that might be relevant to the place of work and the people that they're working with. And then at the top level, thinking about the certification course. Again, just to mention, the certification course is free, so anyone can access that. And certainly wouldn't want to make it exclusive, but I'm conscious that the way that it is presented is not necessarily accessible to everybody who's less familiar with a lecture format. So what have we been doing in terms of the Oxford Brain Story? So we've been doing essentially a lot of training, either online, in person, with sessions kind of ranging in length. I think the shortest one that I ever did was 7 minutes in a Petra Kuch presentation, if anyone's ever done one of those. What we've also done is we have embedded micro sessions to try and help people make that jump between this is the knowledge and actually how is it relevant in my day-to-day job? How is this information, how is this understanding going to make a difference to what I'm doing when I go back to my workplace this afternoon or tomorrow? We've also done a lot of pre-recorded training sessions now, which we've made quite bespoke in terms of the examples that we give to try and again make it as implementable as possible for people who are working in a school setting, people who are working in acute physical healthcare settings, for example. And again, teams are now using those to go through the learning themselves, self-paced, or making it part of their induction package when new starters join their environment. And we've also been playing the brain architecture game as well. So in terms of where we have been doing brain story training, essentially we've talked to anybody who will listen. We've now reached, I think it's probably closer to 3,000 frontline professionals now. Really, again, all over the country. When I gave this presentation last week, someone said, what about London? And actually, I just haven't updated the slide. But really, it's about going where there's enthusiasm, where there's people who have seen this vision and said, yes, I want this for our community. And we've worked with lots of different organisations, both in terms of kind of healthcare, education, social care, but also we've done quite a lot in early years. We've done a lot in academy trusts. We've also kind of used those multidisciplinary neglect forums, which bring kind of local professionals together to talk about relevant issues together. We've also thought about charities, say schools, nationally the Youth Justice Board, the Academy for Social Justice, and we've also done quite a lot of work with the Church of England because they have so many volunteers who are working frontline in kind of parent-toddler groups, but also in primary schools and secondary schools across the country. So like I say, anyone who really will listen. And what have we covered? Again, I've kind of structured this in terms of the metaphors, and depending on how much time we've got and depending on our audience, we've kind of honed in more in these areas, but we've been very much focusing on the science around neural proliferation and pruning, a bit of epigenetics around brain architecture. Again, in terms of serve and return, we've talked about contingent responsiveness, what that looks like for children of different ages or adults of different stages. We've talked about core parenting capacities, and also we've thought quite a lot about how does adversity affect caregiving and how adversity impacts on a caregiver's capacity to notice serves, to return serves. We talk quite a lot about air traffic control, so what are executive functioning skills, and also thinking about how those develop, really again thinking about how might this show up in your workplace, and I'm going to give you an example of that in just a minute. We talk quite a lot about toxic stress, different types of stress, and also allostatic load, which is my own nerdy favourite bit of the science. And we also talk quite a lot about some of the national and international data around ACEs and its links to health and behavioural outcomes. And then also thinking about resilience in terms of helping people think about what makes a difference, and really practical examples of how the resilience scale could be used. So again, just to give you a bit of a flavour, this is one of our fairly standard kind of micro sessions when we stop talking for a little bit and we ask people a question about air traffic control that's relevant to their workplace. So we might ask people who work in a school setting, actually, what air traffic control skills do your students need to get to school in the morning? And again, what actually air traffic control skills do parents need to get to parents' evening, or indeed to book an appointment to get a parents' evening slot? Or again, thinking about in a healthcare setting, actually, what air traffic control skills do your patients need to get to an appointment on time? Because when air traffic control skills are working well, we don't really see them. It's when they start to fall apart that we start to notice. So again, I think we can make huge assumptions as professionals about, well, it's easy to get to an appointment on time. I can do it. Why can't you do it? So it's really starting to get people to think about the assumptions that we make. So we show people, we talk about what these different skills are in terms of planning, organisation, self-control, time management, attention, and so on. And then we ask them, okay, actually, what do people need? So again, I think the hospital in Oxford, the John Radcliffe, the parking is a nightmare. The traffic is about as bad as the Cambridge traffic last night. And actually, I used to work in a surgical team in the hospital, lots of very well-paid professionals all sitting in a room waiting for a patient to arrive. People used to get furious when people didn't turn up or people were late. But actually, I was like, just let's stop and think a minute. What are we expecting of people when they're coming to an appointment at the hospital? Let's just think about the air traffic control skills that are required to get here on time. Actually, there's a vast amount of planning for everybody. Actually, what time do I need to get up? How long is it going to take me to get there? Who's going to take the kids to school? If I'm not finished in time, who's going to pick them up? That whole inhibitory control thing that I think as parents we have every morning about trying not to show our frustration when our kids are not getting ready as fast as we thought they should. Working memory. If I'm going to an appointment at the hospital, actually, I need to take my medication list with me. Do I need to take any other letters, any other paperwork? Have I grabbed my phone from the charger that I left it on last night? And again, the idea of mental flexibility. I thought I was going to get the bus. I've got all this planning sorted out. Now I've missed it. How am I going to get the appointment now? So just to really kind of help people start to think about what this might look like in their setting. We also give people a vignette that is, again, we hope relevant to their place of work in terms of thinking about what a resilience scale might look like, and also encouraging people to think about how they might co-construct a resilience scale with a child or an adult. So thinking about how you might sit alongside somebody and think, actually, it feels like there's a lot going on for you at the moment. Actually, should we just start drawing it out together? One of the many reasons I love the resilience scale is that you don't need a lot of equipment. You need pens. If you've got a red pen and a green pen, all the better. But otherwise, you can literally draw it on the back of an envelope. Actually, let's start thinking about those stresses. Should we represent them as red boxes on one side of the scale? It's a way of starting to engage with people, but also to understand more holistically actually about what's going on for them right now. What might make it difficult to do this task that we're asking them to do at the moment? Or why is it that they might be struggling? And also, crucially important to think about the green boxes. What are the positive supports? What are the things that are going well for you at the moment? And then also helping people to start thinking about the position of the fulcrum as well. So it's really starting to highlight with people, if we're in, for example, a team around the family or a team around the child meeting, can we start thinking about what our different kind of professional roles are going to be? As the clinical psychologist in this situation, what red boxes am I going to be working on? Or actually, am I going to be working on particular skills and abilities to push the fulcrum? What other green boxes can we pull in? And by doing that, we're already starting to get away from that kind of defectiveness schema of there's something wrong with me. I'm not coping. Everyone else seems to be doing okay, but I'm struggling. Well, of course you're struggling because you've got a lot of red boxes, either currently or red boxes from the past. So we need to find you more green boxes. It starts to make it, again, a much more kind of collaborative, universal process. And also, we have clarity about our role as professionals and what everyone else is doing so that we have a shared understanding of why we're doing what we're doing in order to improve resilience. And again, another little plug for the resilience scale as well is I think it also helps families or individuals know, I've got all these different people, I don't really know what they're all supposed to be doing. Everyone keeps coming to visit me, but I don't know why. But actually, when they've got a resilience scale, you can start to say, okay, this is the person who's coming to work on this red box with me, or this is the person who's going to be a green box in terms of my kids. And much trailed, this is the brain architecture game, so this is where we get to play. The challenge is to build a child's brain from conception to aged 8, and you have to build a tower as tall as you can using pipe cleaners and straws. Anyone who thinks about this for more than 2 seconds goes, pipe cleaners, they're quite wobbly. But if you thread your pipe cleaner through a drinking straw, it suddenly becomes much more useful building material. So you start off by throwing a dice, which represents the genetic lottery of your starting point for your fulcrum, and that dictates kind of the starting shape for your tower base. So you can see that in the little images on the bottom, depending on 1 to 6 and what starting base shape you've got. And then you also throw the dice again to see how much social support's available to you as a family. And they come in the form of bonus straws, which you can use when you need them. So we have life experience cards, and they represent positive stress, tolerable or toxic stress. If it's a positive event, you get a pipe cleaner and the all-important straw. And for toxic stress, you just get the pipe cleaner. And when we get to year 6 to 8, then you start adding weights to the top of the tower. As you can imagine, it gets very competitive. But actually, it's a really tangible way of starting to engage people with what makes a difference. When am I a straw for somebody else? Actually, let's think about people who start off with a really good start. Their tower's got really tall. And actually, even though we put loads of weights on later on, actually, their tower is still standing. So in terms of our evaluation strategy, we have looked about kind of knowledge. Actually, do people know more at the end of brain story training than they do at the beginning? We've also tried and capture that application of the knowledge. Actually, do people have an idea about how they might use this knowledge? How might it make a difference? And we've also done one-to-one qualitative interviews as well. Reassuringly, people know more at the end than they did before, which is good. Crucially, we see a really positive shift in terms of how people are describing the way that they'd apply that knowledge to a vignette that's relevant to their workplace, which they complete before and after the training. And in the qualitative interviews, people talk about kind of building their knowledge, but also building their confidence to introduce these concepts to other people. Also talking about building cohesion across services and using the same language. And also that they find that the brain story metaphors are clear, they're accessible, and it's something that they feel confident to share with families. People have also talked about how they've tried to implement this, so starting to really think about how we can get some shift in our systems. And again, I think it's important to say that the brain story really resonates with individuals in terms of their own experiences in a professional context, but also with the clients that they're working with and more broadly. And I think my favourite quote is, again, this idea that the brain story belongs to everything. It's universal and we're all human beings. So again, we're starting to think about how we can be alongside people rather than go, oh, I've got this great knowledge and I know the stuff and you don't. Our key is really trying to get this embedded in kind of pre-existing training structures. So we have now got kind of slots to routinely teach on the nursing course and the social work course and the medical student course and the PGC course in Oxford. So really, again, trying to make sure that this is embedded within professional training structures already. And also, if you're really bold about wanting to kind of get this embedded in our community, then we also need to teach young children themselves. So we developed 3 science lessons which were delivered to Key Stage 3 kids by their usual science teacher. And again, the children knew more afterwards than they did before, which was great. And also they were really able to apply this knowledge to how they would look after a friend's 2-year-old for the day. And this was kind of, I think, one of my best moments in science because their answers were absolutely brilliant. Before I used to think that my baby brother was really annoying, but now I know he's trying to get my attention because he wants to play with me. It's not a deliberate, he's just trying to irritate me and destroy what I'm doing, which was fantastic. So just to wind up really, we are kind of continuing to think about different ways of implementing the brain story and how to evaluate that. Really want to think more broadly now in terms of our evaluation about how does brain story training potentially influence referral pathways or the choice of interventions within different settings, and crucially, does this make a difference to the people who are using those services? And really thinking again about how we can get the Oxford Brain Story into every different kind of part of society so that everyone goes, yes, when I stop them on the street, I know what makes a difference to children's brains. I know why that matters, and I know why that's important for our lifelong health. Thank you.
Thank you very much, Louise, and another fascinating example of democratising and sharing really important learning across a wide sector. We've got time for a couple of questions, if people have questions. Sorry, I'm just looking. Was that a hand over there? No, yes, no. Okay, Elaine near the back there. Thank you. Sorry.
Thanks very much. It's fantastic. I've known about this a long time from Canada and also in Blackpool and with the NSPCC, but it's just brilliant to hear. I knew you were doing this work, but I haven't actually heard you talk about it before. I'm just really interested to know if and whether you've adapted any of the materials at all, because we've had, I've heard some feedback. They are obviously developed in America and in Canada. So, and whether you find you've had any feedback about that, if you haven't, or if you have.
Yeah, no, that's a really good question. As you say, it comes from kind of North America, and the materials were developed in Canada. I think initially we were quite worried about how there's lots of videos and animations that kind of come with the brain story that we do use. We were quite worried about how they would kind of land in the UK context. Actually, nobody has ever said, I didn't like the video, it was too Canadian, I didn't understand it. I think in some ways, because everyone is so used to kind of Netflix, that actually the Canadian, North American accent doesn't matter, and in some ways gets around, I think, lots of the regional variation in accents. And so actually, I suppose some of the issues around kind of, class or education actually almost are taken out of the equation because of that. There are bits of the animations when people look like they're kind of having too much fun on the ski slopes that we don't show, just because, again, it doesn't feel applicable to UK context, whereas in Alberta there is a lot of snow. So, again, we have our own kind of interpretation of that. The thing that we have changed, I think, is really trying to focus people on our kind of face-to-face or online presentations, where we have very much given the core story so that people know a bit about the whole story, but then really trying to target it to the particular area that somebody's working in to really, again, make that kind of application of the knowledge kind of key. So again, the vignettes examples that we use are quite different when we're talking to somebody from the prison service than when we're talking in a primary school. So that's probably where we're tweaking it.
It's time for one more quick question, if there is one. Oh, well, there's two. Okay, we'll squeeze two in. So we'll go fourth row back and then second row back, if we can. I don't know where our microphone people are. Yeah, just thank you very much.
Thank you. Hi. Looking at the stress, where do you see the kind of persistent living in poverty within that? Because it's not usually defined as a toxic stress, but it wouldn't be something that we would expect our families to be resilient. And do the frameworks talk about those? So like when you talk through the air traffic control, and at what point are we looking at some of those factors when mum's planning, that I can't get out of work because I won't get paid, and I might not be able to afford to take you to your appointment. Is that considered within the frameworks and the evaluation as well?
Yeah, so I would absolutely, I often in fact put the cost of living crisis as a red box on people's resilience scale. So again, it's just thinking about, it's just that much harder to, in terms of kind of managing all of those things, actually when you've got lots of red boxes. So again, it's not necessarily going to kind of to to sink you, but it is going to affect your resilience if you're worrying about how am I going to afford the supermarket shop, how am I going to afford heating, how am I going to manage to get a new school uniform, all of those kinds of things. So though the brain story kind of video of toxic stress is very much around the kind of classic ACEs, actually there are lots of other things that people themselves would say, I think this is a red box. So again, when you're drawing a resilience scale up with people, I'm very much talking about what do you think is a red box for you right now? And I'm not going to categorize. There may be sometimes people who think that a relationship is a green box for them, and actually I'm thinking, I really don't think this person is a green box, but actually for you at the moment, that's your perception of that relationship. So it's very much about meeting people with where they're at rather than being purist about kind of what's a red box and what's not. I hope that answers your question, because I think it's really important. And again, I think it helps people understand I was doing okay, and actually now I'm feeling like I'm not doing okay, I'm tipping towards poor outcomes. Well, that's absolutely because, finances have been very, very tight, and now they're tipping, kind of in the wrong direction. So it's about acknowledging the reality of people's lives, I think, and why that makes a difference.
Thank you. Time for one more question just here in the second row. Thank you.
Thank you so much for that talk. I just wondered how you are translating and targeting parents in this work, and what your hopes are in that group in terms of what you want to see as practical action from them.
Thank you. So our kind of key work with parents is around focusing on brain architecture and focusing on serve and return. In terms of then helping them think about with their child of whatever particular age, what serve and return going to look like, actually what role they can play in building their child's brain. But we do also show a short brain builders video, which includes a very brief introduction to all of the different metaphors. It's about 5 minutes long, and I'm currently working on a project to support adolescent parents who are low in mood, both with a behavioural activation intervention to improve their mood, but crucially a key component is around their parenting. And there's going to be supported by parent buddies, so people who've got their own lived experience of being a young parent. And actually I've used the Brain Builders video, which includes all the metaphors with the trainee parent buddies. They've all responded really positively to it. I did have some anxieties about the toxic stress, what's that going to feel like for them, given that they have, many of them experienced very difficult things in their past. But actually, they have had a very positive response to it, a sense of now I understand myself more. I understand the role that I can play in my child's life. You're giving me the tools to know what I can do differently so that actually my child doesn't have the same experiences that I've had in the past. So that's where we've kind of focused our attention. We have done a small amount of work outside of that project with parents purely around the brain story, and again very positive responses, but lots of focus on the positives. What can you do to build air traffic control skills? Let's think about why they're so important, and then let's think about age appropriate activities and opportunities to help your child develop these skills.
Well, that's been a really fascinating way of thinking about. We're going to have to stop questions there, I'm sorry. I knew there'd be more than we could fit in, but really fascinating ideas about how we communicate these really important messages about early child development. So please do join me in thanking Louise for sharing that.